Good morning.
As the world changes rapidly at St. Paul University, Philippines, School of Nursing and Allied Health Sciences, we are committed to focus on what matters most, the value of education by providing learning for all. Join us in Higher Education in Focus, Discover, Visualize, and Reimagine, a global webinar series that explores the challenges, opportunities, and lessons that educational institutions around the world needs. The series will also involve cutting-edge thinking in today's higher education. Learn from higher education experts, thought leaders, researchers, and innovators as they share their expertise about these contemporary topics that will benefit students, educators, and leaders across all disciplines. Good day, world. I am Alan Blaquera, and welcome to the sixth episode of our webinar series, Multidimensional Perspectives of Planetary Health under Anthropocene. This series aims to provide practical competencies and transferable skills in response to the changing landscape of higher education, communicate current global higher education trends and challenges, and explore multiple ways for higher education professionals to respond to the change and transformation brought about by technology and innovation. Before we formally start, here are a few reminders. To welcome us all, may I introduce the Program Director for Nursing at King Faisal University, College of Applied Medical Science, the Vice President of Sigma Honor Society of Nursing, Phi Gamma Chapter, Certification Board of Commissioner, National League for Nursing, a Gallup Certified Strengths Coach, and an adjunct faculty of St. Paul University, Philippines, Dr. Benjo Reboneri.
Thank you, Alan, for always being there in all of our events. So as always, before we start our to start off our topic for this afternoon here in Saudi Arabia, let me just talk about some of the takeaways and some of the reflections from the topic that we had from last week. That was last week. So it is about artificial intelligence, but because I'm a member of the nursing profession, so of course there are a lot of takeaways and also reflective moments along the discussion, because it impacts not only nursing practice but also nursing education, in a field that I was highly active. So I think one of the most important learnings and takeaways that I had from that event is that nurses must understand the relationship between the data that they collect and also the artificial intelligence technologies that they used. Because we are nurses, we are in a profession, or we are healthcare professionals who generate most of the data in the healthcare system, particularly when we are doing the patient documentation. So with this, we basically play an important role in collecting those data or those different types of data that might be and will be eventually be utilized by artificial intelligence tools. But from what I see and from my understanding as well, there are some limitations between the link between nursing documentation and on how these documents may be used for that purposes related to artificial intelligence, such as something that would benefit clinical decision making or administrative reporting or keeping a legal record that is usually taught in undergraduate nursing education. So my takeaway from that understanding from that event is that it is really very timely and contemporary that there's a need for nursing curriculums or for artificial intelligence to at least integrate minimum artificial intelligence in the nursing competencies, or probably a set of domains and concepts that entry-level nurses will benefit. And aside from that, also one of the takeaways that I can still think of, we all know that we are often the end users of these technologies that was mentioned from that previous event. For example, in the hospital, we have advanced clinical decision support systems. So we need to understand that nurses need to be more involved. Nurses need to become a member of the team in that cycle or a collaborator in that cycle. So as you can see around the world, there are a lot of calls for action regarding this issue. So in terms of leadership, nurses need to take the driver's seat in determining which aspects of nursing care can be delegated, and to the key factors also that might that can be introduced, or artificial intelligence technologies that can be introduced in the healthcare system. And also, additionally, nurses can also be meaningfully, rather than tokenistically, involved and contribute in as a key member, as I mentioned a while ago, as collaborator in artificial intelligence development and implementation of teams within any healthcare system. So, lastly, if nurses or if the nursing profession takes a proactive role in addressing those priorities or those reflections and takeaways that I have mentioned, artificial intelligence has the potential to enhance and to extend nursing capabilities. But we must also remember also our ethical responsibility out of those technologies that are emerging. And in return also, nurses or nursing can also contribute to the development, as I mentioned a while ago, in these artificial intelligence systems that can leverage also our skill sets, our skill sets as nurses, and our strengths, basically, and expertise in relational practice, and most importantly, in patient care advocacy. And this will lead towards the development of artificial intelligence that considers patient with a more holistic view. So on the next part of our event, I would like to introduce one of our one of our presenters for this evening, who will deliver his words of inspiration. Let me call on Dr. Benjamin Holarbal. He is the chair for the Research Ethics Committee and a faculty member in the Biological Sciences at St. Paul University, Philippines.
Good morning. Good evening, everyone. I do hope I am audible.
Yeah. Yes, we can hear you. We can hear you.
Thank you for the response, Dr. Benzo. So good evening, everyone. I am tasked for the words of inspiration. So to our university president, Sister Merceditas Oang, SPC, to Dr. Anunciacion Talosig, the Dean of School of Nursing and Allied Health Sciences, to Dr. Byomkesh Talukder, our esteemed speaker, and to our participants in this academic endeavor. Pleasant evening from the Philippines. I think it's good morning there in Toronto and good noon in Saudi. For this evening, we are gathered to witness the talk of Dr. Talukder on multidimensional perspective of planetary health under Anthropocene. As we all know, Anthropocene era represents a new epoch in the history of our planet, characterized by profound impact of human activity on Earth's ecosystem. While this presents significant challenges, it also offers us an opportunity to embrace a new paradigm of planetary health, where we prioritize the health of both people and the planet. We can draw inspiration from the resilience of nature, which has adapted to numerous challenges throughout the history of our planet. By taking a holistic approach to planetary health, we can work toward sustainable solutions that address the root cause of environmental and health problems rather than simply treating the symptoms. We must also recognize that we all have a role to play in this endeavor, whether as individuals, communities, or global institutions. By coming together to prioritize planetary health, we create a brighter future for ourselves and for the generations to come. And lastly, the Anthropocene represents both a challenge and an opportunity, and it is up to us to harness our collective creativity and ingenuity to create a healthier and more sustainable future for all. Once again, magandang gabi po from the Philippines and magandang agham. Thank you very much. Back to you, Dr. Benjo.
Thank you, Dr. Benjamin, for that short inspirational message, and also in behalf of the President of St. Paul University. So now we will formally start our event, but before we do that, let me first introduce our speaker for tonight. So Dr. Byomkesh Talukder is the inaugural Planetary Health Fellow at the Dalale Institute of Global Health Research in York University, Canada, where he works at the intersection of planetary health, health impacts of climate change, sustainability of food and agricultural systems by using systems thinking tools such as system dynamics, agent-based modeling, and multi-criteria decision analysis and index development. Currently, the DI At DI, he has been implementing 3 research projects, which includes complex adaptive modeling of the health impacts of climate change in Malawi, climate change, salinity, and public health in Bangladesh, and digital technologies and local food security. Smallholder farmers in Odisha, India, in the context of COVID-19. His past research applies the complexity science approach to designing sustainability assessment models of food and agricultural systems. Dr. Talukder also has over 15 years of interdisciplinary field and training experience. He holds a PhD in Geography and Environmental Studies in Wilfrid Laurier University in Canada, a Master of Science in Environmental Studies in Queen's University in Canada, and a Master's in Development Science in Hiroshima University, Japan. So let us all welcome our speaker for tonight, Dr. Byomkesh Talukder.
Yeah, hi. Thank you very much, Benjamin, for introducing me. And can I share my slide first, and then I think I can start.
You can do it directly, Doctor. Yes.
Yeah, can I? Okay, yeah, I think we are all set, you know. Yeah. Okay. Yeah. So, so good morning, everybody from Canada. At the outset of my presentation, I would like to thank the organizers and also the other, members of this webinar to give me this opportunity to present my research experience and perspectives on multidimensional perspectives of planetary health and Anthropocene. At the beginning of my talk, I would like to say that this presentation is basically based on a literature review, my research work, as well as also my field observation 20, at almost 20 years in Bangladesh, in Malawi, in Japan, Canada, as well as also in USA. Now, to present my topic, I have divided my presentation in 6 parts. That is, I will try to show that what is Anthropocene, then what are the factors that is actually determining some of the characters of Anthropocene, then planetary health, and then also that how Anthropocene is changing the Earth systems, and then what is the planetary health in the changing Earth systems, and what action we should take to address the planetary health issues and conclusion. Now, let us see what is Anthropocene. First, I would like to thanks the other Benjamin for nicely, define what is Anthropocene. Thank you for that. But as he said, that Anthropocene is a human world. Basically, human is becoming a geological force. So if we look at this diagram, we can understand from this diagram that Earth is formed in 4.5 billion years ago. And then Paleocene era started. I'm not going to explain it. And then Mesozoic started. And but this in Mesozoic is actually the Jurassic is really interesting because there is a movie that Jurassic Park. And then from that Mesozoic, it is Cenozoic. And in the Cenozoic, we are in the Quaternary part that starts from millions of years ago, and now from that is called the Holocene. Then we start Holocene epoch begins in 12,000 years ago, and now from 1950s, this Anthropocene epoch begins. But let me tell you one thing that it is not yet scientifically proved. However, that whether we should call these epochs as Anthropocene epochs or not, because the other epochs that the world has observed, they were basically geological force. The behind of those epochs was the geological force. But now we are telling that human activities, in fact, changing the Earth systems. Whatever it may be, but it is already been recognized by the most influential, media, The Economist. They have published a report in 2011 that said that welcome to the Anthropocene, that the human activities, the human activities is changing the world and world systems. So they published a report and said, so you can understand that the world leaders and influential group already actually recognizing it. And also recently I found that there is actually a journal by Elsevier, that is Anthropocene, Human Interaction with the Earth Systems. That means the scientists or the scholars, they have started doing research on this topic, that is Anthropocene. So we cannot actually deny the human force of changing the Earth systems. Now, what are the forces that actually taking place in the Anthropocene to change the Earth systems? Before going that, we have to understand why we are talking about this. We are talking about this because of the increase of the world population, according to me. In 10,000 BCE, the worldwide, it is only 4 million people. If you look at this graph from here, And then from there, in 2000 BCE, worldwide, it is only 190 million people. And after the 2000 BC, then we are in 2022, and the world population has gradually increased from 600 million in 1700 to 7.7 billion in 2019. This is 2019 report, but right now it is probably 8.8 or 9 billion people in the world. So you can understand how the number of human actually has increased all around the world. Not only that, look at this diagram, it actually showing us the distribution of world population over the last 5,000 years. If you look at this map in 3000 BC, there were only 4 to 5% people, 4 to 5% people per square kilometer, whereas it is almost more than 500 people in per square kilometer all around the world. Not only that, the life expectancy of the population has increased over that time. In 1800, the global average life expectancy was 32 years. Look at this graph here. And it obviously it varied from country to country. That doesn't matter, but on an average, it was 32 years. And in 1950, global average life expectancy has increased for 48 years. And in 2012, it has actually increased in 10 years, although it varies according to country to country. Now, you can understand the number of population has increased, population density has increased, and also the population life expectancy also has increased. Now, all those life expectancy has increased because of the tremendous development in public health, as well as also in global health, and advancement in our socioeconomic conditions, as well as also in medical science. And that is why the scientists and the global experts now saying that we are healthier than ever before. We are healthier because our life expectancy has increased, as I said before, from 40% in 1950 to almost 70% in 2000. Poverty has dropped from 1950, it is like 55% to almost 20%. And child mortality also has gone down from 200 million in 1950 to like 20 million from 1950 to 10 million all around the world. But this achievement didn't happen, without paying anything. It actually happened by the cost of using natural resources. Now look at these diagrams. Then while we have achieved tremendous, health improvement all around the world, but then our carbon dioxide emission actually has increased from 18,000 to 2,000. It is now almost 400 ppm. Then ocean acidification also has increased from 6.5 to 9 nmol per kilogram. Energy use also has increased from 18 to 2000. And also tropical forest loss, because we have converted our forest into land to feed the growing population. And now to grow more crops, as well as also for household use and also other industrial use, freshwater use also has increased. And also we have invested a lot of fertilizers in our agricultural land to make sure our food production. Now, if you look all this graph is showing upwards, increase. So there is no actually a decrease of this. And I think that it is going to be increase in coming years since our population is increasing. Now, I will show some of the graph that how human actually has changed, activity has changed, the Earth systems. So one of the Earth systems is our land surface, and now in the land surface, the human activity is actually changing it by the means of agriculture activities. If you look at our land surface, it is actually 29% land and 71% ocean. In that 29% land, 71% only habitable land, and then we have glaciers, rest is and the barren land. And that 71 habitable land is 50% is agricultural land and 37% is forest and then suburbs. And that 50% of agricultural land, we are using 75% for livestock, for meat and also dairy production, and only 23% for crops. And that 23% also, crops for global cereal supply and also the plant-based food. And then plant-based food, actually, we are using that for meat or dairy and also plant-based food and other things. So you can understand the agriculture has taken most of the habitable land of the world. Not only that what we are doing actually to convert our land into agricultural land. One of the classic examples that we are actually converting our forest, basically the tropical forest, into our agricultural land. That we all know that there was an incidence of Amazon rainforest. It got a tremendous global attention, and the reasons of that Amazon fire was timber extraction, fire, AIDS effects, and extreme drought. And then basically in timber extraction it is said it was the demand of timber as well as also agricultural productions. And because to convert the forest into agricultural land as well as also for the cattle and farm and other things, they actually someone started forest, and that actually spread it all over the Amazon, and that was a huge concern for the global population. Not only that, to convert our land into agriculture land, we have actually converted 35% of the global wetland in 55 years. And from 1970 to 2015, now there is a question why we have converted all the wetland, because we have only 70% habitable land, and from that 70% habitable land, we need land for urbanization, our settlement, as well as also agriculture. So obviously, we will convert the wetland into our agriculture land or our settlements. And from 17,000, actually, they almost 85% of the oil land actually converted or vanished around the world. Not only that, while we are actually, just looking at the land, we are also doing a lot of, tremendous drainage in our oceanosphere or hydrosphere. One of the example, we are using our ocean resources illegally, unreported, unregulated. We are catching a lot of fish from, and that there is a crisis of biodiversity. Not only that, we are also dumping our waste into the ocean. That is also causing a lot of pollution as well as also the impact in the ocean biodiversity and also the ocean systems. And also, as I said before, that we are converting land for urban, the urbanization. The world has seen unprecedented urban expansion all around the world. The village actually is now converting into the urban land. And now we can see that from 1960 to 2007, the urban population has increased from 1 billion to 4 billion. And the rural population also has increased since the world population has increased. It's increased from 2 billion to 3.5 billion. Not only that, our human activities, so that is, we can say that global supply chain, we can see the tremendous transportation all around the world of goods from one part of the world from the another part of the world. The China is supplying throughout the world their goods. We are also supplying our agriculture commodity in many parts of the world. So all those actually are human activity that is taking place on the world. Then humans are using natural resources through mining, and all around the world, we can see that mining is almost everywhere. It is in our ocean, it is in our land, it is in our mountain, it is in our forest. So mining activity is also changing our earth system, as well as also having impact on our environment. Not only that, since our population is increasing, we need a better life, we need energy, and to produce energy, we are using hydroelectric power, and also we need water for irrigation. So all around the world, we can see that the dams actually have spread it. And you can see, look at this map. It is unbelievable that the natural water flow actually interrupted by these dams. And as a result of that, the water cycle has interrupted. Inland freshwater biodiversity also interrupted, and that is also bringing a lot of environmental degradation and environmental impact also. While we are using natural resources, urban expansion has increased. Another thing that is also really a big concern for all around the world, that the global waste generation. From 1990 to 2000, if we look at this, the millions of tons per day waste generation will be from like somewhere 2 to 3 to 12 tons per day. It's unbelievable that how much waste we are actually generating. And as a result of that, for this waste generation, our water is polluted. Water is polluted from the waste, from our household, from our industries, as well as also through the runoff, and also our aquifer is actually now polluted. Our ground water is becoming polluted and also the contaminated. And not only that, one of the waste pollution that really a big concern all around the world through human activities is the plastic. Now, plastic is everywhere. It is in our food, it is in our bodies, it is in our air, it is in our water. And also we are observing a huge air pollution because of the human activities through industrial activities, transportation, waste management, house energy, agriculture factories. And as a result, our air is becoming polluted. Well, our air, our water is polluted. We saw the tremendous, presence of plastics in our air, water, and also our bodies. But another thing that people often forget, that the waste from the food production, that the food that we produce, that we are not actually consuming that efficiently. In an estimation, it is said that 45% of fruit and vegetable are wasted. 35% of the fish and seafood are wasted, and of all cereals, 30% is wasted, and 20% dairy product is wasted, and also 20% of all meat and poultry is also the waste. And you can see that to produce this food, we have invested fertilizer, we have invested land, we have invested capital, we have invested other water and other resources. So it has a huge ecological footprint of this food waste. Not only that, the world is now observing, because the decline of biodiversity because of the agriculture activities, as well as also the food waste, and also the demand of other things. Now the human demand, and as a result of that, all around the world, the wildlife trade has actually increased a lot, and it is actually a threat for the global biodiversity. It is actually threat for our vertebrates, our birds, our reptiles, our amphibians, and also our mammals. And one of the classic examples that while this is actually threat, this is also a huge health concern. It is often said that coronavirus spread through pangolin because of these, the illegal trade from Africa to China and eating them. Just for example. Now we have seen that the air is becoming polluted through human activities, water is polluting, then there is a food storage, there is other issues, but as well as also there is the issues of antimicrobial resistance. Now, 50% of the antibiotics are used by the animals, and that animals we are actually consuming. And now then is also using antimicrobial as a medical product. So that is also causing antimicrobial resistance. Not only that, also through the environmental pollution, that is also spreading the antimicrobial, and also the world is observing the antimicrobial resistance in different parts of the world, and it is said that 10 million people is going to be affected by the antimicrobial resistance issues. Now, we have seen from the previous slide that land is, we are changing our land systems. We are changing. We are using a lot of resources, mining and other things. But why we are doing this? And we are doing this for producing crops to feed ourselves, as well as also to support our livelihood or our daily lives. As a result of that, we are using our biocapacity. In fact, we are using our biocapacity. So now the way we are using our biocapacity in 1960, it was fine that we only need one planet to support that. But the way we are now using it and the population is increasing, if we keep doing this, perhaps we need 2 planets to support our Earth by this biocapacity. So we can see from this Earth, ecological footprint that human activities and human demand has created, and also consumption has created a tremendous pressure in our Earth systems and biodiversity. Now, human activities actually producing carbon dioxide or greenhouse gas emissions. So greenhouse gas emission is coming from our energy sectors. We're using fossil fuel to to lighting ourselves, and we are also using fertilizer in our agriculture, changing our land and waste and industries. So all these things actually relate with the human activities. While we are actually increasing greenhouse gas emission, then our temperature is also going up. Now, this is a diagram from the latest IPCC report, and in this report, it has been shown that in 1900, the world average temperature is like 0.5, in between 0 to 0.5. But now the way we are moving and using natural resources and various human activities in our energy sector, in agriculture sector, industry sectors, temperature actually is increasing at a rate of 1.5 in 19 to 2020, or 2%. And if these activities, human activities, keep happening, that is under the Anthropocene, then the world will observe 2.5 degrees Celsius or maybe 4 degrees Celsius into 2100 or 2060. And that will have a tremendous impact. The baby just born today, he will see a totally different world in 2060 if we don't control carbon emission or control human activities in a very judicious and effective way. And so we probably will not face this increase of temperature, but our future generation, they will see this increase of temperatures. And as a result of that, while the present generation is having a tremendous health impact, and also observing that the worldwide earth system change and environmental change, and also observing a lot of health impacts. And the relation of those changes and in the human health is the core, study areas or core subject matter of the planetary health. By definition, that human health is defined as the safeguarding both human health and the natural system that underpin it. So I have shown that how human activity is actually changing the earth system. Now we will see that what type of earth system we have seen. Now, before moving that, actually the relation of the human activities on our the nature, as well as also that impacts on our earth systems, was actually documented first kind of, according to me, it is, Rachel Carson in his Silent of Spring, when he observed that how overuse of fertilizer and pesticides actually, killing the bird, and as a result of that, the spring became silent. As it's a very nice, documentation that how food production and also or as a human activities actually can create a tremendous pressure in nature, and that actually happened in USA. And now look, and now think that the most advanced countries that happened in 1960s. Now in other countries who actually under now green revolution and to are producing more crops for their own to feed their population, growing population, what is happening there by the name of agriculture, other things. And now this to understand the planetary health, we also have to understand that how the earth is working under different systems. The earth actually is, consists of four spheres, that is atmosphere, biosphere, hydrosphere, and lithospheres. Now we are observing human activities or impact in atmosphere, in biosphere, and hydrosphere, and also the lithosphere. That these four spheres actually complexly adapted and exchanging a lot of energy and also a lot of feedback among themselves. So if anything happen in one sphere, that will have impact on other spheres. So if anything happen in atmosphere, that means increasing of carbon dioxide, and as a result of the increasing of temperature in atmosphere, that is actually having impact on our biosphere as well as also our hydrosphere as well as also the lithospheres. In biosphere, what is happening? It is actually degrading biodiversity. In hydrosphere, ocean is becoming more warm, acidification is increasing. As a result of that, ocean is changing its normal pattern or normal tidal flow. And in lithosphere, is our soil health is changing. Soil, microorganism or the interaction with the humidity and precipitation, that is also changing. Then while this sphere is really important to understand, we also have to understand that we have actually 9 planetary boundaries. And under the boundaries, the Earth is actually performing. We have biosphere integrity, climate change, novel entities and their stratospheric or ozone depletion, and atmospheric aerosol loading, ocean acidification, biochemical flow, freshwater use, and land use systems. And now look at this biosphere integrity, the genetic diversity we already have crossed. Our biochemical flow, the phosphorus and also the nitrogen, we already crossed. Our land change is in dangers, and freshwater use is also going to be moving towards in the danger zone. The red and yellow actually representing moves toward the gender to high impact zones. Not only that, scientists also now really concerned about some of the tipping points. Since the Earth system is changing, our planetary boundary is changing, so they are concerned about the melting as a tipping point, biome shift, and circulation of the change. In case of melting, our glaciers, our in the polar region as well as also the mountain regions, they are disappearing. In the biome, our rainforest or also including, you can see Philippine and also other tropical rainforests, in Indonesia and Malaysia, they are also moving towards the tipping point that where the normal, system will not be back, or the regenerative system will not be back. So they will observe a totally different systems that will have a serious impact on the socio-ecological systems in those countries. Not only that, also the circulation is changing. The Indian monsoon is actually shifting, and the West African monsoon is also shifting, and Atlantic meridional overturning circulation actually breaking down. So this actually tipping point is really concerned for the for our socio-ecological system, for our food system, and as well as also it will bring a lot of new, disease that is unknown. For an example, if the permafrost, that disappears, so it will actually bring back 1,000 years old new virus or bacteria. And we don't know that what type of disease actually is waiting for us in the long run. So it is really a big concern for us. Now, I said that carbon dioxide is increasing. As a result of that, our temperature is increasing. And now the world is actually observing two types of incidents in our atmosphere. One is slow onset event and extreme weather events. Under the slow onset events, it is sea level is rising, salinization is increasing temperature, as I said before, land and forest is degrading, loss of biodiversity, glacier is retreating, and ocean acidification is taking place. And in extreme weather events, it is storm surge, tropical cyclone, drought, flood, and heat wave. And all these slow onset event and extreme weather events is actually having impact in our economic as well as also non-economic issues. In economics, it is actually having impact on our income and in physical assets, and in non-economic issues that is having impacts on individuals, that is in my human health. And in society, it will have impact on our many sustainable development goals or human development index, and also the environment. It will actually change the total ecological systems of the earth. Now, where is the examples of the increasing of temperatures? Look at this graph. It is actually taken in 14 April 2023. Thailand actually observed 45.4 degrees Celsius. Unbelievable. Not only that, India, Bangladesh, and other part also observed deadly heat waves. And it is getting even hotter and hotter. And as a result of that, the occupational health is in serious concern, that who are driving, who are working in the field, or the we have not all the people actually getting the luxury of AC rooms or other things. So most of the people actually is working under the sun, and as a result of that, their health is serious concern. Not only that, all over the world, flood has actually increased. We have seen the news. Flood in Pakistan, flood in India, in China, in Brazil. While the developing country is having a lot of flood, developed country is also having flood. They are actually not out of these changing, earth systems. Germany has faced tremendous flood. The California has faced flood, and while we are observing, the extreme weather event, the world is observing the loss of biodiversity gradually. Look at these diagrams. In North America, 33% biodiversity already gone. Europe, 24% biodiversity is gone. In Asia, 44% biodiversity is already gone, and 66% biodiversity is gone in Africa. And Latin America and Caribbean, it is 94, the paradise where everybody is going for, in vacation in Caribbean or in Latin America. It's 94% biodiversity already gone. And now human activities obviously the major factors of losing biodiversity: illegal trading, hunting, wildlife trading, and cutting trees for fossil fuel, as well as changing forest into the agricultural land. But also nowadays, the increase of temperature also playing a major role in decreasing the biodiversity all around the world. And as a result of that, we have seen that 2007, the red list, that endangered list in mammals, reptiles, and birds were 7,851. Now it is actually 16,900. That means that those 16,900 mammals, reptiles, birds, or insects in total can be disappeared from the world totally. And scientists are saying, and UNESCO, one of the influential body in the world in national decision making, as well as also making global level decision, that 8.1 million species face extinction, will disappear, and 1 million will be the face extinction. While biodiversity degrading, the earth has observed tremendous fire forest all around the world. California is observing fire forest. Australia is observing fire forest. Africa is observing fire forest. Even the Europe, and also most importantly, the boreal fire forest in Russia, unbelievable. And also the Canada is also one of the coldest country in the world. It is also now facing the fire forest. Not only the fire forest is a concern all around the world, but sea level is rising. This is a map taken by the NASA. All around the world, sea level is rising. Now, while sea level is rising, the cities that is actually along the coast, like Dhaka in Bangladesh, Mumbai in India, Cairo in Egypt, and New York, and London, all those big cities, they will face the impact of sea level rise. Now, this sea level rise will actually bring a lot of health impacts through the increase of salinity. And I will show that what type of health impact will happen, because I think that Philippines is also going to face a lot of issues from sea level rise. I will show examples from my own study in Bangladesh. I will show that later. Now, while sea level is rising all around the world, tropical cyclone has increased, and it is becoming bigger and bigger. Look at this recent cyclone in Harvey in Florida. It actually devastated everything. It is now happening also in Bangladesh, in India, and also the Philippines, all the tropical countries where most of the, and by the way, the most of the poor people and developing countries actually along the belt of tropical and subtropical countries. That is very, very interesting. And those people are now actually facing the impact of climate change and also the planetary health issues. Not it is the highly developed countries. They have technology, they have money. They will face problem, but later on. But we are facing the problem. The glaciers is actually disappearing. It's a slow onset event all around the world. I showed that it is a tipping point in our poles, but as well as also Himalayan glacier is melting, and this glacier is already disappeared, and that is happening. That have a tremendous impact on food and agriculture production in the many and these countries in Bolivia and Peru. As a result of that, the mass migration is taking place there, as well as also it is causing other impacts. Now, those extreme weather events and slow events, that is actually because of the changing of the earth system by human activities and increase of temperature, and also like increase of carbon dioxide, having health impacts all around the world. It is injury and mortality from extreme weather events. I already showed it. Waterborne disease and other water-related health impacts, malnutrition and foodborne disease, then heat-related illness, zoonosis, a non-communicable disease, that is also actually hypertension, cancer, kidney disease. I will show those things later on. Respiratory illness that is related with the hypertension and vector-borne disease, and mental and physiological health. Now, those health impacts actually determined by many demographic factor, geographical factor, biological factor, and health status, socio-political condition, and socio-economic factors also. Not only that, but also the health systems where the nurse can play a huge role, according to me, that leadership and governance, health worker, health information system, essential medicine product and technologies, severe delivery, service delivery, and financings. So the extreme weather event and slow onset events bringing different health issues for the global population. But that is actually will be felt differently by different parts and also different vulnerable group based on these vulnerable factors, as well as health system and capacity and resilience. The people who is living in Bangladesh, his their capacity, health system capacity and resilience is lower than the capacity of USA. And as a result, it is obvious as a result of that, the people who are living in that tropical and subtropical zone, that where most of this cyclone is happening, sea level is rising, drought is taking place, fireplace is taking place, they will face more health impact. That's social inequality, because of the social inequality and that the issue of climate justice all around the world, because of the increase of natural disaster of climate due to the climate change, the death actually have increased. This is the a figure related to global disaster related mortality, and we can say it is actually almost 40 60 40 to 60% all around the world, but it varies from time to time. Now, I said in the health impact that the global the malnutrition and the food security, the because of the the changing of the earth systems and also the impact of climate change, the all around the world, the different parts of the world will face the food production and also food related health issues differently, as the food production as well as also like fish production will varies under different climatic scenarios from place to place. Look at these the two maps. It is saying that in most of the tropical and subtropical countries, the food production, they will produce 35% less food, whereas most of the in polar region, they will produce 35% more food. That means climate change actually is an injustice for those people are living in tropical and subtropical countries in terms of food security and food security health issues. Now, all around the world, the earth, as I said, that because of climate change, fish production will reduce. Not only that, the fish, ocean fish actually, the ocean warm because of the climate change. The ocean fish are reshaping. Reshaping means now fish are moving from tropical to subtropical regions. So that those countries like Bangladesh, India, or Philippines, or Indonesia, or other countries who depends on fish, sea fish, the coastal people, gradually they will see that their fish actually disappeared because their fish actually has moved because of the warming ocean to the tropical to the polar countries. That will have a serious problem. Not only that, climate change will alter our cropping growing pattern, while climate change will have a serious impact on our food production. The climate change or the carbon dioxide, increase of carbon dioxide, also having another type of problem. What is that? It is actually altering our protein, micronutrients, vitamin content is rice grain. Now look, just think about the people of Philippines or people of Bangladesh and India who are using rice. They are getting all this protein, micronutrient, and vitamin through the rice on our other cereals. Now, because of increase of temperatures, this will actually reduce. So now to face this micronutrient deficiency, either we have to give a supplementary, or there will be a lot of chronic disease in future, non-communicable disease because of micronutrients deficiency. One of the research that is done by the Oxford University, they actually showed that the protein, zinc, iron, and zinc content in wheat, rice, barley, potato, soybean, and vegetable all around the world actually is decreasing. Climate change is also will cause severe food safety issues through changing in temperature, rainfall, and sea level rise. It will changes in pathogen growth, survival, and other issues, and also it is also have impact of the contamination of crops by facing due to the high level of rainfall or flood. Then also mycotoxin will also increasing food scarcity, and also water scarcity during drought can adversely affect hygiene and sanitary conditions. So food hygiene or food related safety will be a huge concern. And now the food production can reduce in different ways. Just think about the recent locust outburst in Africa, and that locust actually have moved from Africa all around to India and Pakistan. And along its pathway, it actually destroyed all the land. So if 2 or 3 outbreaks of locust happened continuously in 2 cropping season or 3 cropping season, that will actually just create a food insecurity and also famine in those areas, according to me. So it is really a big concern. And also the drought, it is said that the food security increased by 5 to 8% with each flood or drought. Unbelievable around the world. Now, who will be the victim of this security and food related issues? It is actually the children who are living in severe food poverty, and most of the people, that is 40 to 30 to 40% people, are living in this tropical and subtropical region in Africa, and also the India, Bangladesh, and then other part of the world. You can see that it will have a severe impact, the climate related food production, food security in our health. And then the scientists, the planetary health, they are saying the planetary health diet. Then I always ask them question that how you can actually ensure planetary health diet when climate change is going to disrupt our food systems. We cannot even provide, if this continues, if we don't stop climate change or we don't take efficient measures, we cannot give them cereal. Then how can we actually give them animal protein, dietary or vegetable or fruit and vegetables? Because it is not actually working. So that means our health is be in serious concern. Not only that, while food system will be a big problem, then re-emergence of significant mosquito-borne disease, including outbreak, reported natives, and now the mosquito actually moving towards the pole as well as also the high altitudes. And now Nepal, I have seen, where malaria was actually rare because of the cold climate, they are now observing malaria. Not only that, just think about the Canada. Canada is a very cold country, and there was no actually mosquito related disease, but the Canada is also becoming warm, and it is said that warm climate will actually brings mosquitoes, and also there will be mosquito related disease. Now tick is a big problem, and also it is going to be a big concern for the public health for the Canada. So we can say that climate change is actually changing the pattern of the disease, the vector-borne disease all around the world. And the zoonosis, because of this deforestation, microbial resistance, intensification of the agricultures and poultry production, illegal, properly regulated wildlife trade, the factors of the zoonosis emergence actually has gone up. And now the world is actually now observing a lot of zoonotic diseases. Coronavirus can one of the classic examples. We have seen that our communicable disease will increase, non-communicable disease will increase. Another serious issue is actually mental health, especially those who are living in tropical and subtropical countries and smallholder farmers. The loss of in their agriculture land, also the deterioration of the common resources, that is ecological services, that will have a tremendous pressure on their livelihood, as well as also that will deteriorate their mental, because livelihood and deteriorate their mental health, because loss of cross is because they're very poor, and loss of cross they will be in anxiety that what to do, because they don't have that support system, not from the government, not from the community, not from the their social systems. As a result of that, that will face tremendous health pressure. Not only the global poor, or all the smallholder farmers or general people around the world is facing mental health issues, but there is another issue, that is eco anxiety among the adult, that's young adults. And it is said, look at this, the recent poll, and where the young generation, they said they're concerned about wildfire or river flood, crop failure, tropical cyclone, drought, and heat waves. It actually varies according what they are actually facing. This is actually done in USA, so it is said that heat wave is really big concern from them. But this is a kind of eco anxiety, and eco anxiety will bring mental health pressures. And then world migration, since the many places of the world is becoming uninhabitable. As a result of that, world will face mass migration of 100 billion people by 2100 to 2100 years. And not only that, that mass migration actually, as well as can generate a conflict. And then conflict actually bring human crisis. Migration is also bring a lot of human health issues because they are moving in the cities, and cities will face the socio-ecological system of the cities will be disrupted if people start to migrate from a degraded area to the urban land, because urban area is not designed in a way to support those migrant people. So ultimately, they will landed in the slum areas. Now, I will, as I said before, I will give my personal observation and research experience and research findings that what is happening in Bangladesh because of the sea level rise. The coastal area of the Bangladesh is a home of 40 million people. Sea level is rising in coastal Bangladesh because of at 6.0 millimeter per year. Not only that, Bangladesh is also is facing strong cyclone, tropical cyclone almost every year that is bringing strong surge, and strong surge actually bringing saline water. As a result of that, salinity actually has increased in coastal Bangladesh. This is a map showing that salinity contour line from 1973 has gone up towards the north, and 2009 it actually has moved in that area 2009. So that this part actually became saline, and so the coastal areas was groundwater is saline, surface water is saline, and soil is also saline. And salinity actually bringing primary health impact, secondary health impact, and tertiary impact. The primary health impact is scarcity of drinking water because you cannot drink saline water. As a result of that, the water rationing has started in coastal Bangladesh. Saline water as a primary health impact also bringing diarrhea, cholera, dysentery, rashes, itching, skin infection, ocular disease, and typhoid. And secondary health impact, that is not direct health impact, indirect health impact by consuming saline water, hypertension actually has increased. And hypertension, one of the risk factors of cardiovascular disease. And it is already proven by the world scientists from USA, UK, and Australia, and also ICCDDRB, one of the leading research institute in coastal Bangladesh. Not only that, the miscarriage also has increased, and this actually was reported in BBC. So that means we cannot actually deny this report. And it is said that the women who are living near to the coast and consuming a lot of saline water as a drinking water, the rate of miscarriage is really high among them. And reproductive health hygiene. So, then in the menstrual regulations, they need to clean it, but they are not getting fresh water, and it is actually becoming a serious problem. Look at these women are working in the saline water and also one of the livelihood options that catching shrimp fry. And since saline water is destroying ecological services, biodiversity, and it is actually restraining to do diversified agriculture. As a result of that, there is a nutritional security issue, and because of lack of diversified crops, the incidence of rickets among children actually has gone up. This is actually a serious problem. Not only that, kidney disease as a secondary health impact is another problem. If you take too much saline water, your kidney can be affected. Another problem. And one of our observation has found while we are working with our local partner, Bangladesh Cancer Care Research Center in coastal Bangladesh, they have observed the breast cancer is really high in saline zone area among women compared to the freshwater zone areas. There are many reasons related with that. It can be rainwater harvesting because rainwater is coming unregulated asbestos cyst, and asbestos is one of the asbestos is one of the cause of cancer, or maybe the shrimp feed. Because the saline water, people start shrimp fishing, and government is also promoting that. So it is good as an adaptation strategy, but it is also bringing a lot of health issues because they are using heavy metals as a shrimp feed. Now, arsenic can be also another cause because it is also arsenic prone area. And what syndrome disease? This is a viral disease that when shrimp is dying, people are just frying them and eating them. But what is actually happening chemically, and what is there any cause and relation with this breast cancer? It is unknown. We are trying to investigate it. And then another problem is collecting water. Women are standing or 1 to 2 or 3 years after walking 2 to 4 kilometers on an average, and this standing for collecting fresh water actually keep pressuring them. It's actually the mental pressure because they are responsible to collect fresh water for their household, for their children, for their family members. So it is actually really a serious problem. Not only that, the the livelihood option became fewer. I mean that you can only catch shrimp or maybe water related things, since water is increasing, saline and water is moving toward the inlets. And now, as because of the fewer livelihood option, you are already in anxiety that how you can actually support yourself, your family, how you can earn money, because you need to buy food, you need to send your children to school, you need healthcare facilities, and you need money, and livelihood actually is giving you money. So that is a big problem. Not only that, the women especially, they remain in damaged house, and that who is in an unsafe living condition, and that actually has increased the disease. And in Bangladesh, this is also happened because of the increase of salinity, and also saline zone actually moving toward the north, and people actually start migrating, and they actually migrating in the Dhaka city or other urban area. It is this report published in Nature, so we cannot actually deny it, because Nature with a lot of authenticity, they actually publish it. And those people actually moving in the slum area. And as it is, when those people are moving in the slum areas, they are not getting any kind of, that is a tertiary health impact. They are not getting any kind of primary health facilities. They are again facing that freshwater issues, hygienic issues, and they are actually living this kind of more deteriorated inhabitable land. Now, so far, I have actually discussed about the Anthropocene and how human activities under the Anthropocene has changing our earth systems, and what type of system is actually taking place, and what are the health impacts. It's a diverse topic. So I tried to show some of the and through the evidence and personal experience some of the health impacts. Now, what action we should take actually. First of all, that we are in spiral of self-destruction. There is no doubt. Now, the planetary health framework actually is as a unique framework that can actually help in addressing those spiral destructions, since this actually target the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention on the human systems, that is our political, economical, and social, that shape the future of the human and the earth natural systems. So it is actually tremendous. You actually thinking to address these issues holistically and from a systems point of view, that you are not actually just trying to tackle it only from the ecological knowledge or biodiversity knowledge. You are also trying to be bringing your understanding of economics, society, and also the politics, because those things have a huge impact on our human activities, as well as also earth system change. Now, what we need to do to address the planetary health? We learn about planetary health more, reduce our food waste, some of the action that we can actually take, then healthy diets with a low environmental impact, better governance, use water more efficiently, and deforestation, family planning. That is really important, and city planning, because people are moving in the city. Now, I don't think that this is actually a greatest threat for us. I think this is a greatest opportunity for us. If we don't take any kind of action, our children will be malnourished, there will be infection disease, there will be migration and conflict and waterborne disease, and so forth. But if we take effective action, if we want to implement our sustainable development goal, then it will ensure sustainability, it will ensure clean energy and sanitation, and also ensure our cropland. As well as also, if we don't take any kind of action, our tropical storm will keep increasing, sea level will keep rising, fish stock will disappear. But it can be also a great opportunity for us to invest in green jobs and also ensure the food security, as well as also ensure our ocean resources. These are the few the hope that how it can be a greatest opportunity for us. Now, to do that, to take that opportunities, we also have to ensure environmental justice for all. It is not for only global north, it is also for the global south, and the people are living in the tropical and subtropical region. Because that the the almost 40% of the climate-related deaths happen in the poorest countries. That's why we have to ensure global environmental justice. And to ensure global environmental justice, we have to ensure that 17th goals that is actually designed to transform our world, we are achieving that. If we can achieve that, our poverty will reduce, our hunger will reduce, and we will have a good health and well-being. And for that, we need actually partnership. We need collaboration. We need to invest money, and we need to work across the sectors from top down to bottom up under a complex adaptive systems that we have to understand. There are a lot of things that we can actually, take as the action to address the planetary health. One of the action is nature-based approaches. We can actually understand how nature actually helping us to reduce carbon dioxide, carbon sequestration, as well as also providing us a lot of benefits. It can actually offer us livelihood. It can offer us so many provisional and regulatory ecosystem services, and that can actually those regulatory and provisional services are really crucial for good human health as well as also biodiversity benefits. Not only that, there is a new concept that is circular economy, where we have to actually recycle production, distribution, and consumption and reuse. So circular economy, the economic model right now we have is consumption driven. There is a supply and the companies are offering a lot of things and we are just consuming and we are not thinking about the byproduct and what is happening. So now time has come to change our mentality, the awareness among the population, think about the circular economy, that the product we are buying, how circular it is. So what would be the, how we can use this waste into another product, or it can actually without, it will not hamper the ecosystems. And another things that I think that we have to collaborate global north and global south. So far, all the fantastic research, it is actually taking place in global south, and global south is always giving us knowledge. We are actually just looking to them to get their technology and knowledge. But then we also have our own understanding and in our local level, our own adaptation capacity, respect to the biodiversity and how to use those things. So those indigenous knowledge or those community level knowledge is really important. Now, not only the structural solution or scientific solution is important, as well as also we have to understand how our ancestors respect the world and they respect the feedback of the natural systems and how they actually preserve that we have to understand. And I think that time has come to work jointly, global north and south, because COVID has proven we are living in the same world. Nothing is disconnected. Everything is connected in the world. So since everything is connected in the world, we have to think we are the human being of the world, and it is our responsibilities to take care of this planet, to ensure our future generation health, because we cannot actually leave a planet that will not offer anything to our next generation. And one more thing, according to me, that I have came up after working on planetary health issues like 5 years, and before that on climate change, agriculture and food and sustainability in coastal Bangladesh. I think right now planetary health need the factors of eco welfare. That by eco welfare, what do I mean? I mean that we have to have a system that will ensure the biodiversity soundness, ecosystem soundness, or integrity soundness. If we need to invest money, we have to invest money. Like our social welfare. What we do in social welfare? In social welfare, we want to ensure education, we want to ensure human health, human education, human livelihood, and also the food as well as basic needs. So since we are actually ensuring human basic needs, then environment also the basic needs. That is actually eco welfare. We have to invest there too. And also is and some other variable that I consider as a constant. It can be political commitment or policy or other things that which will actually have an impact. So this is a formula that I have been trying to put forward to the global leaders. That's the planetary health requires both eco-welfare and social welfare. You cannot address planetary health only by addressing social welfare or social justice. That is my concern. And also, as I said, we need a system change. Now, while I am saying that eco-welfare and social welfare, can we do it? Yes, we can do it. As a human being, we are doing tremendous things. We are now living in Internet of Things, fourth industrial revolution. AI is there, smart cities approach is there. That means human know that how to actually tackle this. And human have faced throughout the history a lot of issues and environmental issues, conflict and other things, and they have actually became winner by applying their knowledge, their technology. And I think AI is there, the machine learning is there. And just think about the COVID, the way the human actually invented the vaccine, that took only 1 year, 1.5 years. And before that, think about the vaccine of the previous disease that took 50 years or 30 years or 100 years to develop the vaccine. That means human have that capacity, and now we have to use that capacity for the better good. And in the conclusion, I would like to present something different than what I have actually present. I want to give emphasis that why nursing education or medical education or other education need this planetary health and also need the transdisciplinary knowledge. Because so far what I have present, if you look at those things, we need knowledge from land, agriculture, climate, soil, ocean, water, urban environment, migration, economy, all other things. All other things actually, related with human health. Traditionally, medicine science is based on systems within the human body, whereas planetary health broadens health research to include the external systems that sustain or threat human health. So what we are thinking in planetary health, we are trying to take a proactive, action before happening disease in your body. So that's why I think that the medicines, medical science, that the public health, disciplines, and also nursing, they also come into together. Now, you with this nursing school or other, medicine or medical related subject, they can actually take these planetary health planetary health guide for planetary health educations, where they can actually think about this interaction with the nature, the movement and the system change, the Anthropocene, local level health issues, and regional level health issues, local priorities for the planetary health, and also the global priorities for the planetary health in their curriculums. And I think the world is moving there. The medical, subjects, or it was actually totally, according to me, detached from the other disciplines. Now time has come to bring other discipline in the medical science to understand the external impact of the health, that actually the social and environmental determinants of the health. That will actually help our, the health professionals a lot to influence the global leaders, because they also the create awareness how to have a healthy lifestyle. That will be actually a tremendous achievement if you can introduce that. And thank you very much for your listening.
Yes. Thank you so much, Doctor. And most of our participants here are mostly healthcare professionals, which is quite interesting. So I will just have to give my thoughts, because as a nurse or as a healthcare professional, if you will come to think of how we are working in our profession, we are a profession that is deeply based on relationships. And since most of the participants here are nurses, we are also educated in a way to become systems thinkers from the inside and from the outside. And from what we have learned from your presentation, really, we as nurses can make a significant impact in these kinds of initiatives, because, and also I feel that work cannot be done without nurses, for example, because can you imagine we have how many millions, more than 20 million, 25 million nurses and midwives around the world, and basically 50% of the healthcare workforce are nurses. And in our own national organizations, we have strong codes of ethics at the national and international level. But one of the things that I want to mention also is even the International Council for Nurses, they have a statement really focusing on we as nurses, we need to collaborate and also to start to think, to practice on how we can preserve, sustain, and to protect the natural environment and be aware of the health consequences that might impact human beings in the world that we live in, such as the impact of climate change. And um, there are many contributions that we can do. And honestly speaking, it's becoming um, interesting. It's becoming significantly interesting. I mean, on a perspective of in terms of leadership, because there are really many things that you can do. Even on the part of in a nursing school, working in a nursing school, one of the competencies that we would like our nurses to be strong with is advocacy or being an advocate, health education. So we can really take a leap and to contribute in so many ways when it comes to all these initiatives related to planetary health, even in a curriculum perspective, because um, it can be also a curricular thread in a nursing program to integrate service learning. So, the students can be educated on service, which can be aligned with the Sustainable Development Goals or also to planetary health goals. So can you imagine, there are really so many things that healthcare providers, such as nurses like us, we can do a lot. So thank you so much for that presentation, Doctor. And I will be calling in also my colleagues here for them to ask their questions and also to give their takeaways regarding from the discussion, regarding from the topic that we have just discussed, because there are really a lot of keywords and insights that we learn from it. So I would like to call in Alan. Alan, you want to say something? Alan Paulo, please.
Hi. Thank you, Dr. Talukder, for that eye-opening and disturbing presentation. But I think the disturbance is in a good way, so that people will get alarmed and make actions towards improvement. I have a question. Based on your research, what are your recommendations for countries who have higher resiliency on what support they should give to countries that have lower resiliency towards disaster preparedness or disaster resilience? What support should they give?
Yeah, and I think that is a great question. Right now, I think that knowledge and technology, we almost know that what type of knowledge we need to manage the disaster and technology we need to manage. So for most of if I understand you correctly, most of the developing country, they are resilient by themselves, because the people in developing countries really resilient. But then also, I think, but if the force of the the impact is higher than the resilience, then it is a problem. Now we need in a certain period of time to adapt themselves to become more resilient, and for that I think that financial assistance and the commitment of the developed countries, for an example, in IPCC, recent IPCC, the countries actually agreed to create a lost and damaged fund to support those countries from that fund, to improve the resilience activities. That what are the resilience options are there, whether it can be, their education, it can be nature-based solution, approach, like increasing mangrove forest for say, or replantation, or circular agriculture involving in, because most of the people is still involved in agriculture activities, and food is coming from there. So then sustainable housing, and adaptive housing with increase of flood, increase of temperature, those technology can be developed further with the indigenous knowledge. And that's why I think that global north, that's where the most of the highly advanced universities are located, they can do a lot of things there, to improve the resiliency of the vulnerable communities. And at the same time, I would say it is actually local government responsibilities, our political commitments, and also the transparency in our governmental systems is really important. Time has come to create a mass awareness that we need a good governance. We cannot actually live in an inefficient government system. Just now, let me share my experience with Canada and Bangladesh. Canada, why it is a very advanced country? Because it is managed very well. And why Bangladesh is not a developed country? Because it is not managed very well. Bangladesh has all the rules, regulation, and know-how, but it is not managed. So management, that means governance, is a really important issue. Unless people are, and everybody has to be part of it. That is really important.
Yeah. Thank you very much. I have an additional question. So in our institution, in St. Paul University, we are also a research university. In your institution, what are your experiences in lobbying recommendations to changing policies or to talking with lawmakers in the government or the UN? Do you have any experience of lobbying policy?
Yeah. So I have been working with Doctors Without Border. I got a chance. I have been working with Professor James Orvinsky. He's one of the global world leaders. So in our approach, we take actually participatory, critical problem-solving approach, where we want to involve both top-down and bottom-up stakeholders. So in top-down stakeholders, this is policymakers, politicians, and bottom-up is the community peoples who are actually facing the real situations. So we try to bring in our research both parties together and develop a model or develop a systems where both parties can actually negotiate, can exchange their ideas, and can place their actions. So that is actually in that model, that is actually beneficial for both the community as well as also the stakeholders, both external and external stakeholders. So through our research, we have been working on global health humanitarianism, because we think that climate change is going to be a humanitarian crisis in future. Just think about the migration or disease, or in 40 or 50 years, we will see that trend, as well as also global health forecasting. And now under global health humanitarianism, we're trying to develop locally, acceptable and adaptable technologies. For example, in Bangladesh coastal areas, we are giving water purifier, small scale water purifier to the local community to purify saline water, and also thinking that what would be the local solution instead of looking at the industrial solution of the salinity. So we are thinking about the integrated agriculture systems, where we want to do shrimp, rice, vegetable, poultry, and also the tree plantation all together in the same land. And then that's why we are planning to do rainwater harvesting for the surface water. So we have actually, we are also, because research obviously influence the decision makers. In developed country, all the decision are made data-driven decision based on the research findings. In developing country, it is not there, but they are now opening up because they are facing the problem.
Thank you.
Thank you very much.
Thank you, Doctor. Yes, if we can ask more questions. It's becoming more interesting, honestly, this topic, because this has been one of the advocacies also of Sigma, the Tao Honor Society of Nursing, about sustainable development goals, and we did a something related to planetary health. I'm not sure if that will be approved in the global level. So it's something really interesting. Let me call also one of our dear colleagues here, Dr. Alan PJ Lapay. Dr. Alan.
Yes, good evening, and thank you very much for the wonderful sharing tonight. My takeaway from this seminar, from this webinar, no. First and foremost, there is a need for us to redeem. We human beings need to redeem that peaceful coexistence or peaceful relation of man and nature or the environment.
Absolutely.
I think most of the times, or most of the occurrences that is happening to us, it is also a way of nature's telling us that, hey, you have forgotten me. So this is our home, and one of the things that we should never do is destroy our home. And here in St. Paul University, Philippines, our environmental advocacy is so strong, and at the same time, we are trying to provide a conducive learning environment for our students. That's the reason why our university is a Hall of Fame in the search for most eco-friendly and sustainable school in Region 2. So when you come to our school and when you come to our university, it's a totally different environment. And one former secretary of our Ministry of Education or the Department of Education here in the Philippines branded our university as a school in a garden. So it is a total different environment when you come to the university because we are emphasizing not only in our curricular activities, even in our service learning, and even in our research function and the research function of the university, to emphasize also on what we can do to improve the health of our planet, the quality of life, not only to human being, but the quality of life of our planet. And at the same time, we are also trying to look into or dig deeper into our respective role as human beings and as a Polinian, what can we contribute to uplift or to sustain, and at the same uplift and sustain and transform education as a tool or as a tool for us to improve quality of life through Planetary. Thank you very much.
Oh, thank you, Alan. Yeah, you are absolutely right. In fact, you know what you said that I think that we have to uh, we have to drop ego to eco, you know, because we have as a human we have a lot of ego that we are the
Yes,
superior than anything.
yes,
Now,
yes, doctor.
yeah, that's why I said that not only you know social welfare is important as well as also because our human development index, the social welfare actually got highest priority by the name of life expectancy and education, but there is nothing to preserve our ecosystem or ecological services. That's why I said that eco welfare time has come that we have to take into consideration eco welfare. Without both, we cannot
Yes,
actually sustain.
yes, doctor. Thank you very much for the wonderful sharing. We learned a lot
Thank,
tonight.
yeah, thank you.
Thank you so much, Dr. Alan. That's actually what you have said is really powerful as well. And considering that thinking of the university, really, the university is green. Thinking of during the times when we are still studying there. And also, let me call Dr. Benjamin. Also, please, Dr. Benjamin Ularbal, please, if you would like uh, to share your takeaways before we quickly read the messages of the participants, please.
Hello, good evening. I hope I am audible po again.
Yeah, yeah.
Uh, Thank you. First of all, thank you, Dr. Byomkesh, for the wonderful talk. I learned a lot personally. Actually, I'm not a nurse. Rather, I am a biologist by profession. So I have also been teaching to my students the concept of global health or planetary health. This is a takeaway that I can attribute to the talk of Dr. Talukder.
Thank you.
Uh,
Thank you.
in uh, in the curriculum, we go into curriculum based. In for the curriculum, especially for health sciences, I do believe we should integrate, or there should an integration of a one health approach, because we can argue that basically the health of the environment will basically affect the health of the organisms that are present in that particular environment. So technically, what are the organisms that are present in the environment? The human. So basically, we need to instill in the curriculum that we need to at least take care of the environment, so that at least the organisms or the humans that are present in the environment will also be healthy.
Absolutely.
So I do believe that one health approach in the curriculum must be integrated, because technically one health would mean or would indicate interconnectedness of human health, animal health, and the environment. So with that in mind, basically, as I was mentioning, yeah, there is really a need to take into account the integration of One Health, most especially in the curriculum of health sciences.
Yeah.
Thank you. Again, I thank Dr. Talukder for a wonderful talk, especially for climate change. Thank you very much.
Thank you, Benjamin. Yeah, I also agree with you. We should have to integrate One Health or Planetary Health approach in our health science curriculums. Not only health science, my approach is I think it should be
All.
in all disciplines.
Thank you.
In all.
Thank you, Dr. Benjamin. Let me, because one of our participants is raising her hand. Dr. Sudhir, are you still there? Because she wants to ask something. Doctor, please.
Uh,
Okay,
yeah, thank you very much. I'm very much there. Yeah. Uh, I have actually two queries. First of all, I would like to thank the university and Dr. Byomkesh for a wonderful interactive session and a great informative session. It was really excellent. I really thoroughly enjoyed it. Uh, the two queries which I have. One is that the oceanic temperatures are going up extremely fast, affecting the aquatic marine life in a very severe way. Now, this is the backbone of the planetary health in every sense. Uh, but if we look at it from the perspective of energy flow of the nature, then there is a huge amount of energy which is getting stored because of the temperature rise in the ocean. One point of time, this is going to saturate and release like volcano. Then what happens? That is my one question,
Very fast.
one query. Second,
We
second,
have to
second,
die.
second query is, it may sound funny, but the environment doesn't have any boundaries. Geopolitical boundaries doesn't exist
Absolutely.
for environment. So there is a synergy and coordinated balance which is being maintained by the nature. This synergy could be both ways. It could be constructive as well as destructive. But it also has a great buffering capacity to accommodate and adjust to suit the conditions as they change and vary. It's a dynamic system. But still there is a boundary or there is a limit for any region or any area to survive. The moment that I think Dr. Vyomkesh showed some slides with black spots and red spots, and which were very the critical or the danger points. So when these limits are crossed, then what happens? Because we don't have any study or documentation or research in either of these two directions that I just spoke about. So any idea, anyone of you could help in having some information or input
Yeah,
or insights in this?
I think the great question. I want to address your first question first. That is, the ocean is warming, obviously, and perhaps you know that the 70% oxygen is coming from ocean.
Yes.
That most of the
True.
people don't know this. They think that ocean is coming from the atmosphere, but actually
Yes.
70% of oxygen of the world oxygen is coming from the ocean. Now, so once ocean is actually warming, that will have a severe impact on ocean biodiversity. There is no doubt. On phytoplankton and then food chain and also the other biodiversity. So according to me, if that burst, after accumulated, uh, there is no way to survive.
But you mentioned about this being an opportunity in action
Yeah.
points or solutions at the end of
Yeah,
your
yeah.
session.
Now let me come to the point.
Yeah.
Now, what
Yeah.
we can do. So,
Yeah.
but we also know how to actually, how to actually protect that and how to manage that. So one of the is a nature-based solution. So a lot of studies going on blue carbon economy, that how you can actually protect your ocean biodiversity, mangrove, there is actually also the forest under the ocean also, then coral reef. So
Yeah.
scientists are not actually sitting idle. They are doing a lot of research and they are actually finding the way how to do that. So that is actually my hope that, people now aware for planting tree. I think people will be also aware to plant, to preserve the ocean biodiversity, as well as also how we can actually reduce CO2. Now, even we can reduce CO2 in 20 years. I think that there will be no problem in the ocean. Ocean is not actually in the tipping point yet, but some of the tipping point that I showed, that our monsoon rain or boreal forest or melting of glaciers, without actually stopping increase of temperature, I don't know how to stop melting of glacier. There is no such mechanism. We can plant trees, but we cannot actually stop melting glacier in the high mountain. We don't have that mechanism. As well as also,
No, reduction of GHG is one of the key issues or key factors, in my opinion.
Excuse me?
Reducing the greenhouse gases.
Absolutely,
Yeah,
absolutely.
but and
That is
it has to be done. It has to be done not as on a mega scale. It has to be done on millions and millions of micro scale level solutions.
absolutely, absolutely. That's why I think I said that awareness is really
Yeah.
important. I mean that
Absolutely, I agree.
absolutely awareness, and also the local community level, micro level, mitigation.
Yes.
Mitigation. I mean, how we can mitigate, because adaptation is one thing, but mitigation is that actually will reduce CO2.
Correct. Correct.
And that's
That's
why
correct.
I mean that smart city is one of the way. Not we don't want to use car. We want to have a smart city, public transport or bicycling. One of the way, and also the consumption. Not congestion has to change. That's why I said our economic model will have to be changed. And colonial economic model, colonial economic, that's the decolonization of the economic model is really important, because it is actually supply and demand, and based on consumption driven market. So that has to be changed. As well as also one more thing is, as you said, local initiative. I think local cultural diversity is important. You look at the biodiversity preservation, local cultural diversity plays a huge role. Just think about the Indian population. They used to wear a one piece of cloth. Now they are wearing the Western dress, that suit, pant, tie. So you are now, but in Indian context, it's a hot country. You don't need to wear suit, pant, and tie. You need to wear a one piece
I agree.
just to
Yes.
cover your private part. That is enough.
Yes.
Now,
Doctor,
once you
yes, Dr.
Yeah.
Sudhir, I will definitely connect you with Dr. Byomkesh. If you have more questions, you can feel free to ask him more questions, because definitely he's the best person to address all those questions that you would like to ask. So I will just quickly browse the messages of our participants here before we close into our event. So we have here from Ms. Rowena, thank you for that informative webinar and skillful presenter. The topic is timely, a few research spurts that some causes some causes of diseases are related to unhealthy Earth. The need to be aware and proactive in planetary health, you know, initiative among healthcare personnel is the best health preventive measures that we can advocate. And then most of our participants here are expressing very insightful and educating. Okay, we have some questions, but we do not have time to probably address. But I will be taking all these questions and I will connect you all to Dr. Byomkesh.
Okay, that will be great.
Yes. Another thing here is global justice as equality, the belief that everyone should be the same kind and amount of stuff. So we have here some, there's also another question, but I will have to keep all these questions. I will be putting these questions as well. So there are a lot. Well, anyway, to close in our event, because our time is quite limited, of course, as always, we would like to personally express our gratitude, as always, to St. Paul University, Philippines, for their support, the support of the university, especially with this. And also, of course, the president of St. Paul University, Philippines, the president of St. Paul University, Philippines, Sister Merceditas Ang, for her unending support, also for our series of webinar events, and also for the to the dean of the college or the School of Health Sciences, Dr. Anta Losig, and of course to all my dear colleagues here who is always game to support and also to provide their insights and takeaways in each of the series of events that we are doing. And lastly, of course, we would like to extend our thanks to our speaker, Dr. Byomkesh. Thank you very much. And as always, we are joyful and thank you for educating us about this very topic that is timely, and it is indeed an avenue where healthcare providers like us can think of ways also and to have that realization that we can do a lot of things to preserve our planet Earth. And of course, with the impact that your topic has brought us. So we will forever be grateful for that. And also for the next event, I really hope that all the participants will be still attend. And thank you very much. And we will be looking at each other again on our next event that is related to innovation and technology. So any last words, Dr. Byomkesh, before we close?
No, I just would like to thank you personally, as well as also SPUP for organizing this webinar and giving me a chance to present my ideas, my research, and also interacting with the participant. I wish everybody a good day. Have a good day, everybody. I say good night.
Yes, of course, also to our participants, you need to do the evaluation first. So if you can do the evaluation, and we are really glad that we have diverse participants. We have participants from Australia, we have from China, we have from the Philippines, and also Saudi Arabia, India as well, and Egypt. Thank you very much for attending, and I really hope that you will stick to attend our webinar events and also the value that it is bringing us as educators and also as healthcare professionals. Thank you very much. So please do the evaluation before we close the event. I will be giving you 3 to 5 minutes just to do the evaluation. Thank you.
Okay, then Benjamin, I think I can go now.
Yes.
Right? Okay, then I'm leaving. Everybody, thank you very much for your listening. Okay, take care. Bye.
Doctor, thank you. I will just give you one more minute before we close the Zoom, okay?